Christina Cunliffe, who is a principal of the McTimoney College of Chiropractic, which is part of the College of Health.
Hello, everybody. Good afternoon, and thank you for the opportunity to allow me to give you a whistle-stop tour through chiropractic. So I'm just going to share my screen now with you. Can you all see that? Perfect. So my name's Christina Cunliffe. I'm the principal, as just been said, of the McTimoney College of Chiropractic, which is one of the accredited colleges of chiropractic in the United Kingdom. I am still a practicing chiropractor, which I think is important to keep me in touch with the profession. And I run a multidisciplinary clinic in the Oxfordshire countryside. By way of background, as a chiropractor, I had previously worked within a GP surgery. So I do understand the interrelationship between chiropractic and general practice. In common with all of these talks today, we're going to go through some definitions, some origins of the profession, how it works, its uses and benefits, importantly, how it works with conventional medicine, and also some case studies that will hopefully bring it to life for you in the day-to-day situation. So first of all, a definition. What's in a definition? But this is, I think, a reasonably good one. It's by the World Federation of Chiropractic. And I'll just read it out because I think there are important words in here. A health profession concerned with the diagnosis, treatment and prevention of disorders of the musculoskeletal system, but importantly, the effects of these disorders on the function of the nervous system and general health. And that's very much the focus of chiropractic, improving the nervous system, improving the well-being of the health of the individual, but focused on the musculoskeletal system. Obviously, we use manual treatments, which I'll talk about a little bit later, which involve spinal adjustment, but also we will do mobilizations and soft tissue work as appropriate and needed. Chiropractic has been around for a while, 128 years, in fact, this year. You can place manipulation back to cave drawings and the Greeks, and there is a very common route from all sorts of manipulative medicines back to the bone setters and folk medicine in whatever country you're in. But chiropractic officially, if you like, came to the UK in the 1920s. And in that time, we've grown and developed as a profession. And the general standard is a 4 or 5 year master's in chiropractic, which will allow graduates to register with the General Chiropractic Council. And then students will go on to undertake postgrad specialities. We are a regulated profession. We're one of the regulated professions, and we are regulated by the General Chiropractic Council. And the Chiropractors Act was passed in 1994. I also think importantly, in terms of the credibility of the profession, we have a Royal College. The Royal College of Chiropractors was formed in 1999. We got our Royal prefix in 2013. And this college runs the postgraduate, the post-registration training year on behalf of the profession. So training as a chiropractor will take 5 to 6 years in order to go through that post-registration training as well. And I think importantly as well, all of the medical royal colleges had to sign off on the College of Chiropractors in order for it to come into being. So how does it work? Well, I think the best way to describe this really is to talk about what we would do, if a patient came to us. Our aim is to improve the functioning of the spine, therefore the nervous system. And as a chiropractor, what I'm interested in is removing the impediment to the body's own self-healing ability. So it's not about, a pill or a potion or surgery from the outside in. It's about how can we empower patients to improve their health from the inside out. So when a patient comes to us, because we're primary care practitioners, we undertake a full assessment of the patient because it's important that we rule out any underlying pathology. There are a number of things that can mask, let's say, as back pain, and we're trained to make sure that we are making sure that that is not what's going on. So we would then refer for other interventions if necessary, whether those would be blood tests or X-rays or MRI, if necessary to get that diagnosis. But if it's assumed that it's safe to continue, then as a chiropractor, what I'm going to be doing is checking the spine. In fact, I'm going to be checking the whole body, but primarily the spine, to see where there may be some dysfunction. So let's say there's some problems with radiating pain down the leg. I'm going to trace that back to the low spine, to the lumbar spine, and see where I need to adjust, to mobilize, to move that, to get it moving properly again, to relieve the pressure on the nerve and hopefully help the healing process. And as I said earlier, it isn't just about the adjustment, which is the important thing for me as a chiropractor, but it's about settling that adjustment, because sometimes if things have been in the wrong place, the muscles get tight and uncomfortable, and you've got to settle those back again so the adjustment can continue to do its work. Chiropractors also don't just adjust. It's about making sure that patient again is empowered to change their own health. And so we might give them some exercises. We would be talking to them about their lifestyle and seeing how that might be modified to get them active on their own behalf, look at their posture, and make sure that they're engaged in their own recovery. Chiropractic is a very, very safe profession. But what would be normal after adjustments, after a session, especially in the early days until the patient and the body becomes used to it, you might get some stiffness, some aching. Often people feel very, very tired because that's where the recovery energy is coming from. They can feel a bit stiff, like they'd gone down the gym and wish they hadn't done, the next day. And those are all perfectly normal responses, because we want there to be change. The body has been held in the wrong position for so long, and it needs to recover itself in order for it to improve and move forward. Now, many uses and benefits, obviously, of chiropractic, but I think it's probably best well known for musculoskeletal problems. And certainly there is high quality research evidence to support the use of chiropractic for back pain, neck pain, and headaches. And it's as a result of that strong research base that chiropractic was included in the low back guidelines for the Royal College of General Practitioners, now the NICE guidelines as well. And it was that led to the regulation of chiropractic, because there was a quantitative research base to underpin its use and the benefits of what we do. As I said earlier, very safe and effective, and across the age range, really. I mean, adults form the main basis of our patient base, of course, and that's about reducing pain, increasing mobility, rehabilitating people back into normal function again. But there are also lifestyle things. I mean, you talk about sports, but I'm just mentioning pregnancy there, because that's about helping the woman with their posture, as the body changes through the pregnancy process. And also in later life. I used to call it geriatric care until I started to approach it. So now I call it later life. And obviously you can't turn back the sands of time. But what you can do is you can again help mobility, rebalance, give people an improvement in their, quality of life. Chiropractors are highly trained diagnosticians. Basically, the chiropractic program is equivalent to a medical degree program, and I lecture on a number of medical programs, and it absolutely is. We have different interventions, of course, but in terms of the underlying science and the diagnostics of healthcare, we are trained to ensure that patients can be referred back into the medical profession if some underlying pathology is detected or suspected, in order to make sure that we're doing the right thing in the right time. But assuming that's the case, as well as getting the body back into normal functioning again, what we like to do is look at making sure that the patient can really get back into a healthy lifestyle again. So it's really giving advice on diet, nutrition, exercise, public health initiatives. These are all things that impact on people's lives, and they're things that may affect their ongoing well-being in the future. So this is not judgmental at all. It's just giving people help and advice. and pointing out to them where they might make changes in their life that would improve their overall health and well-being, and also, of course, their musculoskeletal health as well. See people across the age range, but also across the lifestyle range as well. You know, we see sports people who are pretty healthy, but actually want greater performance out of their lives. They want that little bit of extra edge. Very much into wellness care, keeping people well and healthy, rather than this tipping backwards and forwards between pain, no pain, pain, no pain. What's going on beneath? What's causing that? What can we do to adjust and help your body? But what advice can we give you around that, so that make sure that you're doing the right things and not doing certain things that might be impeding your health and recovery. The important thing for us really is around active self-management. And I think this is probably where it also interrelates most closely with social prescribing, in that it's not about providing a pill for every ill. It's making sure that that individual knows what they can do and empower them to do what they need to do to make the relevant change in their life, alongside, you know, anyone else that can help them, you know, along that journey. Uses with conventional medicine. Well, you know, as I've said, we're a primary care regulated profession, readily accepted by GPs and consultants. So GPs will refer to chiropractors for management of musculoskeletal conditions. And you may know that, you know, musculoskeletal, MSK as we call it, is one of the biggest burdens on the National Health Service. And if we can improve that patient in the early days, then hopefully it won't continue towards the knee replacements and the hip replacements of the future. But many patients will have healthcare insurance, and sometimes GP, you know, the insurance will require a GP referral to a chiropractor. So they would pick that up and refer to us so that we can do that. I think what everybody recognizes is that conservative care is the most important thing. Sometimes patients will need drugs to help them with their pain, but that isn't the solution. That's just masking the problem. And also, if we can improve the conditions so they don't need to go for surgery, that is also a much better outcome for the patient as well. So I think GPs recognize conservative care in the sense of trying to prevent the need for, you know, a lot of drug use just to mask the problem, and also prior to, hopefully, meaning that the patient doesn't need the surgery alongside that. So co-management really is the real key to this, because some conditions can be relatively simple, some a little bit more complex, and it's about managing that within, you know, conventional medicine as well. Chiropractors will always, as I've said previously, refer into the medical profession for further investigations as needs be. We can refer privately, we can refer within the health service as well. And I just think it's really part of that interdisciplinary care. What's in the best interest of the patient? So I will give exercise advice, but if I think that patient needs deeper exercise advice or further advice, I might refer into a physiotherapist. I might give some basic nutritional advice, but if I needed to, I would refer to a dietitian or a nutritionist and so on. Sometimes dentists can be very important as well, especially if there are neck problems and headache problems. Sometimes it's as simple as the bite has changed. Podiatrists, certainly the way you walk and interface with your feet and the ground can alter your posture and the way that you work. So we all have an intervention to make that's in the interests of the patient, but co-managing that alongside conventional medicine, I think, is crucial. So a couple of case studies, and they look long, but they're actually relatively simple in the sense that low back pain, neck and headache. So behind the words here are some really simple things. People present with a problem. The first one, low back pain, radiating pain, tingling numbness. You know, we know what may have caused it. Tried over-the-counter medication, got some medication from the GP, only gave short-term relief because it's not dealing with the underlying problem. Chiropractor will test to see what's going on, and in this case, they've determined it's a disc herniation. Care plan in place, adjustments, soft tissue, exercises, outcome, reduction in pain, improvement in mobility, and a reduced need for medication. Yeah. So it's about looking at the mix of things to try and achieve a better outcome for the patient. So that's a relatively serious issue of low back pain, but with less complex issues, the improvements can be complete. Neck and headache. Patient comes in with some headaches, aching in the back of the neck. We would call that a cervicogenic headache. Heat helps. That says there's a muscle involvement. Testing says there's nothing else going on. So what do? Again, adjust, soft therapy, exercise, get the patient moving, postural advice, get them doing things differently. And in this case, the outcome is basically, it's resolved because we're dealing with the cause of the headache, not just trying to mask the pain with headaches, which will help the patient manage it, of course, but is not going to completely resolve the issue. And it's just going to keep coming back and back. Patients will come in with a combination of these things, but I've just sort of given you a couple of simple examples there to give you the idea of how we might intervene. So finally, in summary, chiropractic is one of the regulated healthcare professions, as I've said. We've been regulated for over 20 years. Strong evidence for the effectiveness of chiropractic intervention. All chiropractors work in acute care to remove pain, improve mobility, trying to deal with the presenting symptoms as they come to us. But many of us will also work in ongoing care to improve well-being and the quality of life of the individual patient. I'm often asked about, is it available under the NHS? There are some chiropractors that work in the NHS, but generally not. Chiropractors generally work in private practice, but all chiropractors will adjust their fees for social groups, and many, many chiropractors will also do pro bono work, because ultimately what we want to do is improve the health of that individual person, and we would never let money get in the way of that happening. So that was a quick run through. As I've said, there's the McTimoney College in the bottom left of the logo screen there. And thank you for listening. Happy to take any questions as they have come in.
Thank you very much, Christina. Thank you very much. So questions come in. Can you tell us if there are any common misconceptions and how you tackle that when you speak to your patients?
Yeah, the common misconceptions, I guess, would be that they think it's a quick fix. They may come to us with a problem they've had for 5 years, and they think a couple of sessions are going to sort it out. And I think there's also that sense sometimes that they think we are going to fix it. And our view very much is that it's a partnership with the patient. And I think people, particularly these days, quick pill hides the pain, and health is more than just the absence of pain. So it's about talking to them, engaging with them, getting them to understand that sometimes it's what they've done, and it could be an accident that started the whole thing off, and then they've adapted to that. But by changing their posture, by doing various things like that, working together with them. So I think that working together, that partnership, is the first thing that we try and get them to understand the reasons behind their problems. And we have more time with a patient than a GP does, to be able to take the time to do that, and to get them to understand that what we have to do is re-educate their body and go back to the place where the body feels comfortable, that it isn't just a quick fix. I would say those would be the two main things that come to my mind just at the moment.
Thank you.
Okay. You kind of answered the next question, but it was focusing on, so how long does a typical treatment last for the patient to notice a change or a difference?
Yeah, we would spend the time with the patient that we need. Appointment times will differ between about 15 to 30 minutes, depending on where you are in the care cycle, a little bit longer at the start, but as you improve, less time. It's not about the time, obviously. But I would say that a patient should start to feel a difference within 2 or 3 sessions. Difference meaning change, knowing that they're on the road to recovery. But depending on how long they've had the problem, it could be 4 or 5 sessions to resolve the acute problem. Now, clearly, if there's radiating pain like sciatica, that's going to take longer to resolve than a simple back pain. Personally, I would say simple back pain, 4 sessions. Something more complicated, longer than that. But the key thing is to talk to the patient along the way. Now, that's in the acute phase. But then if people feel, let's say someone has arthritis, they're a little bit older, the body's deteriorated a bit, then it's about talking to them about what would make sense for them on an ongoing basis, perhaps once every 3 months or something, just to maintain the health that we have already delivered for them.
Lovely. So one final question. So it's more about the training. So to become a chiropractor, is there any form of training that involves nutrition and learning about nutrition? I think this relates to giving, lifestyle advice.
Yes, it's not a large part of the curriculum, but we absolutely understand that we have to, just like with exercises, we're not physios, we're not nutritionists or dietitians, but it's about that general advice that a GP, for example, would give a patient as well. So yes, there is a module on the program where nutrition is discussed. And again, some of the common presentations and how you would deal with it.
Lovely. Thank you very much, Christina.